Hey, hello everyone. Happy Thanksgiving week. So this week we're going to be talking about developmental approaches. Just a couple things before we get started here, just a few reminders and housekeeping items. So the rough draft introduction paper was due yesterday. So if you haven't done so, please turn that in so that I can get you feedback as soon as possible. It's not graded, but I want to see that you've incorporated feedback from the rough draft. And then just a reminder that the final draft version is due on December 8th, and that's the last day of classes. So make sure that your assignment is submitted on time because final grades will be due shortly after, and I want to make sure that your grades are uploaded and updated. And then another reminder, there's going to be a quiz that's also due the last week on December 8th. All right, so just to recap what we talked about last week. So we talked about correlational studies. So just a few points just to recap. So correlation does not equal causation. We talked about a positive correlation, which is when one variable increases and the other also increases, or when one variable decreases and the other also decreases. Then we have a negative correlation, which is when one variable increases, the other decreases. So in other words, the variables move in the opposite direction. We talked about that the most common or well-known way to calculate correlations is with the Pearson product moment correlation. And then we also talked about some types of analyses using or for when someone has more than one variable. All right, so just to start off here with our topic this week, so why would a researcher choose a developmental approach over an experimental approach that we know is controlled? It's kind of the gold standard. So we're really doing this kind of research when we're interested on changes over time. So for example, trying to answer questions like how do life events impact health, medical health and mental health? How does age impact intelligence? And what are the most important factors related to lifetime happiness? So a few weeks ago, we looked at the Harvard study of adult development, and where they talked about that relationships and a sense of belonging, as opposed to loneliness, was one of the things that predicted longevity and happiness. So that was something that they figured out through a longitudinal research design. So the Baines chapter talks about that cross-sectional designs were implemented before longitudinal designs were developed. So a cross-sectional design is a design in which an investigator studies groups differing on some characteristics. So for example, different age groups, but they're studied at the same time. And so comparisons can be made between the two groups. In contrast, a longitudinal approach studies the same individuals over time. So the cross-sectional design was it was a very common method that was used during the early 1900s. And one of the things that was noted in some of the early research in behavioral sciences was that there was a problem replicating the findings from cross-sectional designs. So one of the things that they found was that cohort effects were found to be influential on individuals' development. And I apologize for the noise, I have a little study buddy here with me. All right, so what is a cohort? A cohort is a population that shares a common characteristic. In developmental research, it's often age-related. So for example, older adults is a common group that you'll see studied. It could also include cohorts of various professions. So the chapter talks about nurses, it could also be psychology students, but a group that share a pretty specific characteristic. What is a cohort effect? So this refers to a life experience or culture that contributes to group changes. So we can think of some examples here as having lived through the Great Depression and the impact that that had on that age group, on that particular cohort. We could think about being an immigrant in an immigrant family during the process of immigration and different time periods in which that happened, like the period of Ellis Island, and then families that are currently trying to immigrate now at the US and Mexico border, and the impact of that experience on someone's development and mental health. So longitudinal research is kind of an umbrella term, and this is describes research that usually follows a sample of individuals over a long period of time, sometimes decades, using repeated measures to assess for change. And this tends to be preferred over cross-sectional designs due to issues like cohort effects, which we just talked about. And it's preferred that researchers use multiple measurements over time versus two-point studies. So giving a measure, waiting a certain amount of time, and then giving a second measure. And the reason for this is that there's a phenomenon in statistics called regression to the mean. And all that that means is that extreme scores, so those outliers at the beginning, tend to kind of even out. They kind of tend to move toward the mean during the second test. And so that can be due to various things, but usually measurement error. And so it's preferred to have multiple different tests and measures that are done on the sample over time. And the types of longitudinal research that are discussed in the chapter, the important thing that kind of distinguishes them is more so the process by which people are sampled for the research. So next we have trend studies. So this is a type of longitudinal design, but participants are selected at random during each testing interval. So participants are coming from the same group, but it's different individuals that are being selected to participate in the research. And this kind of study is more common among medical literature, but it does have some applications in psychology. So for example, working in an inpatient psychiatric hospital, we had to administer suicide risk assessments on the patients and determine if they had any factors that were supported in the research or shown in the research to contribute to suicidal behavior or suicidal attempts. And so, for example, being male was one risk factor in the research. And so this kind of research is helpful for conducting or kind of comparing the individual to a group in behavioral sciences. It's just kind of an example. Then we have cohort studies. So like we talked about before, a cohort is a very specific group of individuals, and those people are studied over time, but participants are selected at random during each testing interval. And this is different from trend studies that examine more broad groups of people. And this, again, is more common amongst medical research, but has applications to behavioral sciences and psychology. Then we have cohort sequential studies. So this is a repeated examination of a cohort, but with new individuals added in waves. So if we think about adults over 60, you have those individuals 60 plus, then you have this new group of individuals, a younger group that's moving up into that age range, turning 60, and there that wave of individuals is added then to the sample. And that can be useful determining, kind of ruling out cohort effects and determining if there's something about the age of 60 or something about a certain characteristic that is notable, and kind of ruling out some of those cohort or mitigating some of those effects from cohort impact. Then last, we have a panel study. So this is a type of longitudinal research where the same individuals are studied over a long period of time. And there's some issues with this design. One of the major issues is attrition, and this is due to a large burden on participants, participant dropout, that sort of thing. So moving into disadvantages of longitudinal designs as a whole. So with retrospective studies, so when we're asking individuals to think about how many times they went to the gym in the last 2 weeks, there's going to be some issues with humans remembering things. So we tend to misremember things. We tend to attribute a different number maybe, or have a false estimation, whether that's purposeful or not purposeful. But there's some issues with self-report. And so then also there's an issue with attrition, like we just talked about. So participants disengage, some participants might die, depending on the type of research in the sample. And then there's the question of, for those participants who remain in the study, are they a biased sample in some way? Is there something that's characteristic about the people that remain in the study like their motivation or their conscientiousness. Is there something about them uh, that made them continue to be in the sample group as opposed to people who dropped out? And then we talked about this in previous weeks, but the logistics of conducting this kind of research is difficult. There is a high cost. It's hard to continue research over decades when you have people that research, that retire, and are passing along the research to uh, folks up and coming, and just the continuity of that is difficult. So then the chapter talks about single subject experimentation. So this is sort of a unique method of conducting research, and this arose from the behaviorism movement of the that should say 1900s, mid-century, when the behaviorist movement kind of unfolded. And so within single subject experimentation, we have what's called withdrawal designs. So this would be when baseline data is collected, intervention data is collected, and then baseline data is collected again. So this is also known as an ABA design. So baseline, intervention, baseline. And this is helpful to assess the effectiveness of an intervention. But we have to assume that the participant's symptoms or behaviors will change during the intervention phase and then return to baseline. So that's kind of the hypothesis there. Additionally, there's also an ABAB design, which kind of expands upon the ABA design, and it's another set of applying the intervention. And this might help increase internal validity. So researchers are a little bit more certain that it was the intervention that caused the change in the individual's behaviors or symptoms. So one of the advantages of using this kind of research is that it's internally valid, and this is due to the level of control over the experiment. But one of the disadvantages on the other end is that it could lack external validity. So how applicable is this research on a single subject to the whole population of people? So that is definitely a drawback. Then we have a single subject RCT. So this is when one subject is exposed to treatment and placebo periods randomly over a period of time to observe changes. And this is usually done in a double-blind method where the hope is to reduce experimenter effects. And this is only effective with conditions that are chronic, conditions that are stable, so they don't vary over time in their severity, and they remit relatively quickly so that changes are observable between baseline, intervention, and then baseline. Then we have case studies. So this is a interesting area, an interesting method of research. So this entails examining one participant or a few participants in great detail. It may or may not include manipulation of variables, and it can be useful to gain an in-depth understanding of a condition that rarely occurs. So for example, there was a video posted to this week about patient HM, who's kind of famous in the field of psychology and specifically neuropsychology. So this individual, he was a young man in his late teens, early 20s, and he was experiencing symptoms of a seizure disorder. And at the time, one of the interventions that was used frequently for lots of different ailments was a lobotomy. And so for those that don't know, a lobotomy is a surgical procedure. I think there's different methods that were used at the time, but essentially making changes surgically to the brain. So he underwent a lobotomy in the hopes that it would assist with his seizure symptoms. And the hypothesis was that patients with psychosis that received lobotomies who also had seizure disorders, their seizures decreased or went away. And so there's a hypothesis that on this individual who is otherwise neurotypical and does not have psychosis, that his seizures would also remit. As a result of the lobotomy, there was a resection impacting his hippocampus. So his hippocampus was damaged, and he suffered as a result an inability to form new memories. Um, and so he was studied a great deal throughout his adult life, pretty much up until his death after his surgery, when it was discovered that he could not form new memories. And so lots of intelligence tests were administered for him. And it really helped the field in understanding the role of the hippocampus in the brain in the formation of memories. Um, the video talks about some ethical concerns in doing research like this, especially with somebody who has a condition where they're not aware that they have a condition. They don't remember that they are in a study or that they're being studied. And so there's some interesting discussion about that in that video. Um, all right, so that's it. So next week, just a little segue there, we'll get into ethical issues in research. And so we'll review some videos, and that's it. So stay tuned. Thanks, everyone.